So mostly what it means is that there are more people at risk than there were before. Who knows how many people have contracted HIV in the world? Most recent figure. Should we look it up? What do you think? 38 what? 38 million? Yeah, last I heard 37.9 million people were infected with HIV. What do you suppose the percentage is of people that
She's not in her office.
No, she came in pretty early to help with the test. What do you suppose the percentage is of people who pass away from AIDS after having contracted HIV virus? It's pretty changeable, but it's a lot less than it used to be. You people used to think, okay, if you've got HIV, you're gonna die. People live entire, healthy, happy lives with HIV and do just fine, but they have to be careful. People could have partners and be in long-term relationships with HIV if their partner does not have it and still be just fine. How do you suppose they do that?
A low viral load.
They have a low viral load, yes. If they get low enough, how low do you think is it supposed to be? Low enough, they're supposed to be not able to pass it on. 1,500, something like that. Yeah. Anyway, your viral load is low enough, you can't pass it on. And then they have, we recommend condoms, and they have PrEP, pre-exposure prophylaxis. So for people who are in a relationship with somebody who has HIV, they can take medication prior to engaging in sex and be protected from it. Is it 100%? No. But we take what we can get, right? This is an old one. It's from 2008 to 2020, it changed from 33 million to like 39 million. Extra 5 million people. 6 million, yeah. 7.9, 38, yeah. World Health Organization, that's 2018, so it's constantly increasing. But it's not moving as quickly as it used to. Can you get HIV from kissing? Are you sure?
Sounds like you may.
What if somebody has an active bleeding sore in their mouth?
Why you kiss?
And they're French kissing? Can they pass it on?
Yeah.
The answer is yes. Normally, kissing is not an issue, but you can get it from kissing. HIV is not transmitted by hugging, shaking hands, sharing toilets, sharing dishes. So a lot of what we do is going to be education for our patients and their families. To be able to teach people, you have to know about it. I'm still working on that myself. Center for Disease Control recommends against engaging in this activity with a person known to be infected. When in doubt, check the CDC. Where did it come from? Right there, at least that's what they believe. They've narrowed it down as much as they can, and they think it originally came from some kind of monkey, either eating monkey meat or something a little less common. But the interesting part is that we can contract, this is interesting too, we can contract illnesses from animals, and one of our recent coronavirus victims had a pet, and they discovered the pet was infected with HIV or with coronavirus. I think it was here in Washington. Some of the wasting disease that goes on with advanced HIV and AIDS can be really scary. This was an incredible photo. I wish I could get rid of the purple stripe, but it's still an incredible photo. Democratic Republic of the Congo. Their beaches are apparently just as beautiful as ours. Maybe I'll go there. Maybe I won't. I'm a little afraid of Africa. In fact, I understand there's a lot of people from other countries that were going to vacation in the U.S. and they're not gonna do it now because we have, the whole coronavirus thing. Where can you get it? You can get it from your mom. You used to be able to get it from blood. You think you can still get it from blood? When the HIV virus first came out, there were a bunch of people that were getting blood transfusions that contracted HIV. When they found out about it, they established a very, very thorough screening process to prevent that. We're gonna go into it a little bit later down in Spill's lab, but blood, most of it is from people that are volunteering to give blood. You used to give blood all the time. In fact, they like my platelets too. But these days, what they're doing, they take the blood from me and they send it straight to the lab and they screen it to make sure that it doesn't have any of those. They ask you up front when you're gonna give blood. In fact, each and every time they ask you, have you been in a homosexual relationship even once? Do you have AIDS or HIV?
Well, the question they ask is like in the past 6 months. If it was just like once, like at some point in your life, it's not as relevant because the incubation period for HIV is 3 months. So if it's been in the past 6 months, that's what they care about. If you've been like a celibate gay man, that's okay. Or
Yeah. I haven't given blood lately, so they might have changed it up. Thank you for that. We're not gonna go a whole bunch into this. I want you to understand about those CD4 helper T cells. I want you to understand that the virus actually penetrates the cell and inside the cell reproduces itself. Stages. HIV infection stage 1. When your CD4 count is 500 to 1200. Some places say 500 to 1500, but it's higher. Stage 2 HIV infection. Your CD4 count, and these are numbers you need to remember, is 200 and 500, 200 to 499.
Excuse me.
HIV infection stage 3, also called AIDS, when your CD4 count is below 200. This is interesting. This talks about, you can see the viral load is the pink one. For the first couple of weeks, you don't see much of anything. And then it goes up pretty quickly. Your antibodies, you have an antibody, your body makes antibodies. Shortly after it detects it, your body starts to make antibodies. As the antibodies come up, they get higher, then your viral load decreases. Does it go away? No, not really, but it will go down to the point where it's not causing any additional problems. But that's actually when you're in the latent period. One of our students correctly asserted that this is an important aspect of this subject. Let's look at the most current information. Hello. CDC is the go-to place to learn about anything contagious. Why am I not getting it right up front? Centers for Disease Control. If you're looking for the most current information, if you want to give your patient teaching connected to this or their family, and families are huge, you got to make sure that everybody around them is aware and is not panicking needlessly. This is the place to go, and this is what you can refer them to. Is the current best information on this subject. Wrong one. Don't you hate that? we're assessing people, a lot of times you can just get a general look at them and see if there's anything that's causing problems. You know, sometimes they're thinner, sometimes they have an obvious infection, they're sniffling, sneezing, eyes are watery. Psychosocial status is huge in this, partially because it used to be such a concern, partially because of the lifestyle that usually accompanies it. Down in Olympia, back in the 80s, when this thing first started out, there was a bathhouse down there, and they had a whole bunch of visitors, and most of the visitors went there for relationships, and it became famous because there was so much of the HIV virus that was passed around, and so many people, a lot of them were involved in long-term relationships. They would go recreational down in this bathhouse, take it home, and all of a sudden their wife has it, or their husband. Can you imagine the psychosocial aspect of somebody who hasn't been straight up with their partner, and then their partner tests positive for HIV? They need to identify potential risk factors. Anybody, what do you think? Oh, I got my name. Who did we pick on last time? Alyssa, tell me some risk factors. Anybody else? First,
IV drug use.
IV drug use, yes. Anybody else?
Accidental needle sticks. Accidental needle sticks.
Accidental needle stick. Why did you mention that? I have a story to tell you. There was a guy who was stealing mail. He was really good at it. He would take the mail up into a hotel room and process it, and actually take checks and erase information from them and add new information, taking off the campsite or cash stuff. But they caught him. He had a van full of mail. He had bags and bags full of people's mail. So I was identifying victims, and he was a heroin addict. So I asked him up front, is there anything in that van that's gonna poke me? Any needles? And he said, no, you're good. I said, all right, thank you very much, I appreciate that. You want being straight up with me. So I went into the van, and there was these big plastic bags. And I was taking plastic bags out of the van so I could open them up and look at them. And I grabbed one of the plastic bags and went, ouch. He had tied a used syringe into the knot on the top of the bag. Son of a gun. I didn't hurt him. I wanted to. I went back and talked to him again with a partner, so first told me to witness it. I said, so there was a needle tied into the knot on that bag that you told me about. He said, yeah, did you poke yourself? I said, oh, yeah, so I had to leave the room. So I had like 3 months of HIV treatment, just to be on the safe side. What's the likelihood that somebody can actually contract HIV from a needle stick like that?
1 in 300.
It's very, very small.
You were a police officer, this is what you're saying? Did you press charges against him?
No.
I would have.
Yeah.
You get beat his ass for
I'd
press
actually
charges.
the prosecutor that it would go. Our prosecutors were pretty. Minimum reckless endangerment. Yeah, in fact, I had to wear a condom for 3 months. A long-term relationship. What the heck? My wife was still thrilled about that. So what do you suppose the psychosocial aspect of that is? Yeah, I was in none of the high-risk groups. I was all of a sudden at high risk for HIV. It worked out okay, I survived. Check their immune system function. What are we looking at when we're talking about an immune system? What can we do? How do we test it? Joe?
CDC?
Yes, that's a really good one. What would we be looking at?
Innovative, white blood cell.
Yeah, white blood cells, basically. We're doing a complete blood count. But, what's the most obvious thing when we're looking at somebody to see if their immune system is intact? Do they have any open wounds, right? That's your primary protection against infection. Nutritional status. Are they eating right? A lot of people who are heroin users, this is interesting too, they say heroin really is not bad for you. People take heroin all the time. I knew 2 or 3 heroin addicts that had 8-hour-a-day jobs. One of them worked in an office. Nobody had a clue. In fact, they were injecting under their fingernails. But because they were getting paid well, they had no problem going out and buying their heroin. The problem is that it's so addictive that you've got to have it, and it's illegal. So you tend to do illegal things to get it. And that's when your body starts to deteriorate. Assess their skin, we talked about that. Respiratory status. Are they coughing and hacking? Fluid and electrolyte balance, and it'd be part of one of those lab draws we were talking about. Assess their neurologic status. It can actually change things up. The further along they are in advancement of HIV infection, the worse it gets. They've got a test you can do at home. This is huge. Tell your patients that you think are at risk about this. Tell your family members and your friends. Is it absolute? No. Will it give you a good indication if you're HIV positive? Yes. And when you do, that's when you go see the doctor. But this helps a lot of people, so they don't have to worry about going in to see the doctor. You can pick it up at the pharmacy. They can do in-office testing, and it's usually pretty quick. We use something similar to that, but it has to be confirmed with a viral load test. And the viral load, what are we talking about? Oh, I don't think we've gotten the numbers yet, have we? Your antibodies perform in 2 to 4 weeks. If you have the antibodies, they're saying that you're probably HIV positive. And that CD4, remember our immune lecture? What's the CD4 cell? That's that helper T cell. Insta rapid HIV test. So suppose somebody is positive, they take this test and it comes back positive. What do you tell them? Anybody hear of a Western blot test? Let's go a little further. The ELISA, enzyme-linked immunosorbent assay, is the most common. It's a screening test that detects HIV antibodies, but it's not diagnostic. If they're positive with the ELISA test, they are not positively HIV positive. It has to be through the Western blot. If it's positive, you can repeat it on the same blood sample. If it's negative, repeat in 3 to 6 months, as antibodies have not had time to build up during the window period. Washington state law says you must counsel anybody who does the screening. I would remember that. The Western blot, that's what they use to confirm the HIV test. It can usually take 3 days, but it varies. And they're actually getting some that are a little faster. And 3 days can be nerve-wracking. Trust me, I know. HIV. Some of the diagnostic tests measures the amount of the actual virus in the blood sample. It's a good predictor of progression of the CD4. It's repeated during treatment to determine how well the medications are working. The idea is to get them down to what we were talking about, the undetectable viral load. If their viral load, the amount of virus in their blood system is undetectable, then they are considered no longer infective, which is huge. A person with an undetectable viral load cannot pass the virus to another person. Where'd he go? Some of the different medications they have. This isn't going to be huge for you. I want you to recognize the names of the medications that are used to treat HIV. And I want you to kind of understand how they're taken and what the side effects are. But they have first, second, third, fourth generation. I think they've even progressed beyond that. But this is the viral load that they're talking about. When you, day 0 is when you have the potential exposure to HIV, when you grab that needle in the vein. Day 9 to 14, the viral load can be detected. You can take a test a week and a half to 2 weeks after what you think the exposure is. Day 16, the P24, that's the antigen that our body recognizes when it's reacting to that. P24 is the antigen, you should remember that. The 4th generation antigen antibody test can detect it at day 28. And the antibody test can detect HIV at 90 days. I just want you to understand what a phenotype is. The genotype is the DNA. When the DNA interacts with the environment, it creates a phenotype. There's a bunch of different subtypes. P24 is the thing of the human, the HIV virus. Some of the counseling. So somebody came in and you gave them an HIV test, and a few days later you find out that they are positive. Call them into the office. Don't tell them over the telephone. Try to make sure they have somebody with them when you tell them. Talk to them about some behavior changes.
Is counseling required for all HIV testing or just the blood testing?
The Western blot test is the go-to one. That's the one that actually will create a diagnosis of positive for HIV.
Yeah, but like, are you required to give counseling for like if you're doing like the rapid tests, like in office?
Yes. Because we want to make sure that they're educated as far as what the risk factors are, some of the lifestyle behavior, things that can cause it, things that cannot cause it. And it never hurts to talk to your patients who are at risk in the first place. Chances are they're as educated about it as you are, maybe more so. But it's important for you to do so, and it's Washington state law. Help them to set realistic behavior change goals. What can they do? What can they not do?
Wear protection.
Hmm?
Wear protection. You're talking about behavior change goals?
Where protection is huge. Risk reduction opportunities, like wear protection. If you have more than one partner, more than one sex partner, evaluate who you're with very carefully. Provide yes.
On the notes on the screen, it says how to clean, like examples of teaching is how to clean drug injection equipment as needed. How do you clean drug injection equipment?
That's a carryover from the previous one.
Okay.
Don't clean drug. Don't clean syringes.
I was
Right.
reuse or get a new one.
Yeah.
Syringes.
In fact, Seattle is pretty progressive in that area. Sometimes they can give you fresh syringes and safe places to use them. Thank you for that. I have to figure out how to get rid of it. illegal to hide from your partner the fact that you are HIV positive. There's a guy from Spokane. He was involved in multiple relationships while he was positive for HIV. He didn't tell any of his partners. He sent him to prison for 178 years. That's what I said. He's not gonna live that long. I think sometimes people do it just out of frustration. Why me? Counseling would be huge for somebody like this. They're frustrated, they're angry, and they don't mind taking it out on the world. Nurses are in a perfect spot to counsel that person. Houston, a lot of emergency medical records, electronic medical records, have alerts that tell the provider, you have to counsel this person. In fact, I think most all of them do anymore, because it is a state law. So when you see people that are taking those medications, make sure that you're talking to them and their families. This is kind of a better version of that previous slide that we showed you. The helper T cells, the antibodies, the virus. As the virus, we have helper T cells all the time, right? As the virus increases, our helper T cells die. And then they pick up a little bit and they kind of level out at about the same time the virus is in the latent period. Our antibodies pick up, they're fighting the virus, but at some point, they are no longer in the latent period. The virus starts to pick up. When it does, the antibodies die, and the helper T cells die. The virus gets to where it's too high for the antibodies and helper T cells to fight it. And that's when we get overwhelmed, and that's when we end up with AIDS. I love this slide. Stages. So, no age-defining condition. Your CD4 count is more than 500. You could have flu-like symptoms for 1 to 4 weeks, myalgia, just an aching of the body. Lymphadenopathy, so your lymph nodes could be enlarged and tender. You could be forming antibodies between 2 and 4 weeks after exposure. This is stage 1. No age-defining condition, CD4 count is 200 to 500. You are probably asymptomatic, or if any symptoms at all that are mild. Your CD4 count are decreasing, and you have a weaker immune system response. And the progression is kind of based on the person, depends on how sick they were, or how healthy they were to start with. This is stage 2. The CD4 count below 200. Stage 3, it's progressive. It'll just get worse. You see your viral load and the CD4 count are increasing viral load and the CD4 counts are decreasing. You're subject, because your immune system is so depressed, you're subject to other infections, like that PJP. PJP, it's a pneumonia that goes specifically with AIDS, but it's very common. You're more susceptible for cancers. You get that wasting syndrome. Remember the slide at the beginning where the guy was so thin? And your central nervous system can become involved. Highly active antiretroviral therapy. Usually they'll double them up. They'll give you more than one medication at a time. And these are some of the different ways they work. Mostly I want you to understand, I'm not going to ask you to memorize which drugs do which. I want you to recognize the names of the drugs and the side effects that they have. Yes.
So So they usually do like a combo of this, they find one that works for them, that get the viral load down. Do you ever go like a tolerance to it, or do you have to switch it up, or once you find what works for you, you just stay on that drug till you pass away? I'm curious about that.
Everybody's different. I think the doctor will probably start with a very common one, and if it works for you, great. If not, they'll probably try something else.
Does the body get to the point where it doesn't work for them anymore, is my question.
Yeah.
Yeah, I guess just keep switching it up and down. Okay, curious.
Sometimes, not every time. I mean, sometimes it gets to the point where either they're just too far gone before they start the medications, or the medications just aren't strong enough, or maybe they were had an exceptionally high viral load. But like I say, the idea is to bring the viral load down. They can never remove it completely.
During my CNA program, we had a gentleman who was HIV positive come and talk to us, and he literally pulled out all of his medications, and the whole entire table was full, and he was like, this one, and then this one is to counteract this one, and he had like 30 meds he was taking daily.
Yeah, it's scary. A whole bunch of medication. Yeah, Hershey.
Is it possible to go back in stages, or like once you have a stage, you're kind of like set, then you
No,
just
it's progressive. You can't go back.
can't go back to.
Like I say, the goal is to bring your viral load down, the amount of virus in your system, to the point where it's not causing you any problems and you're not contagious anymore. So, maybe, I don't know, maybe someday they'll find out a way to just clean them out of your system. Recognize the difference between heart and cart. Alright, this is the one we were talking about. These are combinations that they use, and some of what each one of them do. Like that prep that I was talking about, Truvada or Descovy. And these are pretty common medications that go with HIV infection.
Mark, I just had a comment. I worked in a community health clinic, and so there was a nurse run program that actually runs all those prep programs and stuff. And like a really important thing about that prep is that patients have to take it every single day, and can't miss doses. And so it's really important that there's like a plan in place for patients to be able to get access to their medications and make sure they have enough doses to last them, like with insurance and stuff like that. So educating patients, they have to take it every single day at the same time. If they miss at all, then they have to get tested again and then go through the whole process again. Because if they were to contract HIV and be on that medication, then that HIV could potentially develop resistance to that medication.
That's good.
That would be really bad, because then there would be HIV resistant viruses going out in the community, which would be really bad. So there's like a whole education on that every day.
Yeah, and get very involved. One of the main things, like say with PrEP, it's hugely expensive. So if they have insurance, and insurance is trying to find a reason not to give it to them because they're saving money, and if they don't have insurance, chances are they can't afford it.
There is, on that note, at Community Health Clinic, they did have a case manager from Lifelong AIDS Alliance, because there's complicated paperwork from the state of Washington. You could get it covered for free, but it's like a million pages of paperwork that average person would be able to fill out. So there are resources that are available for patients to be able to get that medication covered 100%, but it's about connecting the patient to all these resources in time, and then again making sure they're able to access that every 3 months to get in for testing, to get in.
As a rule, the insurance companies usually turn people down up front, and you have to request they review it or reevaluate it at risk.
I believe that Medicaid covers PrEP in full under the Affordable Care Act because it is a preventative medication.
Current administration is looking at getting rid of Medicaid and its connection to the Affordable Care Act. Something for us to be aware of and to educate our patients and families. Some of the combinations that they use, because very frequently they're using combinations if one isn't strong enough. some of the reactions that go with cart drugs. Usually lactic acidosis, hepatitis. These are very hard on the liver. Acute short-time mood, sleep disturbance, paresthesias, neuropathies. There's a lot of different issues that turn up with these. It would be a good idea to look at all the side effects of these. See if this will work. PJP, pneumocystis jirovecii pneumonia, PJP. It's usually around, and most people have the natural resistance to it, so they don't have to worry about it. But once you become HIV positive or with AIDS, it's huge. Most everybody comes up with it. Toxoplasmosis. And we know about that because we were talking about how pregnant women can contract it from changing cat litter boxes. MAC, Mycobacterium avium complex. It's everywhere, literally. Most any water you drink, if it's not out of a water bottle, probably has this bacteria in it. But you're more susceptible to it. Kaposi sarcoma. Has anybody seen a patient with these? Big purple spots all over. And there's a slide in here a little bit later I'll show you. It's almost always specific to AIDS. And usually when they're into the whole body waist-in section, that's when that shows up. Cytomegalovirus. It's a herpes virus basically, and it's passed through bodily fluids. Most all bodily fluids. So a lot of people are at risk for it. And tuberculosis, of course. That PJP is the most common infection that accompanies AIDS. Some of the symptoms could be non-specific and include a non-productive cough. People may not recognize that they have it, and you won't be able to identify it until they've actually cultured it. How would they culture it? Put that sputum, right? So you collect sputum from the patient, send it off to the lab. They usually treat it with trimethoprim sulfamethoxazole. Easy to say. Contaminating, it's hard on your kidneys, and it increases your sensitivity to the sun. Good one to remember. Toxoplasmosis is the world's most common parasite. You can get it in undercooked meat, cat feces, unwashed fruits and vegetables. Creates flu-like symptoms. It even affects healthy people. It can cause brain lesions. So this is where one of the things you're running into if you have somebody with HIV, their neurological status is affected. Pyrimethamine. That's Kaposi sarcoma. These are fairly small, but you can see the whole wasting part of this that goes on with this patient. It can involve multiple organ systems. It's not just on the surface. They're uncomfortable, they can ulcerate, they can actually open up, cause problems, and it affects multiple organs. All right. Let's take a quick break. 10 minutes, I've got 9:27.